Welcome, welcome. Today we're going to talk about health and a lot of things. So we're going to allow a lot of y'all to get online and catch up with us.
First part comes tech. Got to get all that together. Gotcha.
Well, we need to keep on schedule. So good morning, everyone. Welcome to No Cameras in the Kitchen, where we have honest conversations and real stories and meaningful discussions that matter. We're so glad you're here. While everyone joins us, let us know where you're watching from in the comments, and we'll get started in a few minutes.
See if I can get you live.
Good morning, good morning, good morning. We're going to do a little bit of introductions, and first, I want to introduce you to Lisa Boykin. She is a physical assistant, a physician's assistant, sorry. And she's going to give you a little description about herself.
So I live in the Five Points area. I grew up there and I've been there my whole life. I'm a physician assistant for the past, actually 38 years. I was figuring that on the way over here. I love what I do. It's a lot more challenging now that since COVID came, things are a lot more challenging. But I love what I do. I work with all types of populations. I work in urgent care for UC Health currently. I've been there now for the past 5 years. I was with Kaiser for 32 years. So I've kind of been doing medicine for a long time, not to mention that I grew up right across the street from St. Joseph Hospital. So my mom worked in the hospital, and I've just been around medicine my whole life. And I'm so excited and honored to be here with Miss Angela. No cameras in the kitchen, so let's see what we're going to talk about today.
And I am Angela S. Johnson. I'm one of the hosts. One of our other hosts couldn't be here at this podcast, but she will be here in the second one. And I'm the owner of Whippoorwill Hair and More, and a lot of other ones. But today we're here to talk about
Health
health.
in our communities. So excited to get started.
So the first thing I'm going to talk about is getting to know your profession.
So I'm a physician assistant, like I said. In 1965, after Vietnam War, the Navy corpsmen came out, and they were all trained as physicians, but they came out and they didn't have jobs because they didn't have MD behind their name. So what they did was create the physician assistant program. So in 1967, they created the physician assistant program where you had to go through for 2 years, train with doctors, and then you would be able to get your certification. Right now it's actually a 3-year program, so that's changed, and you can get your master's. So it took me 2 years to do my undergraduate, as far as my associates. Then I did my bachelor's, which was another 2 years. But actually, that's supposed to be the goal. But because I had a learning disability, it took me a little bit longer. It took me 14 years to complete the whole process. And that was because I also had children, and I needed to be there for them too. So I had to go part-time, unfortunately. So basically we train with the medical students, and we get our degrees, and then we can come out and we can be in any specialty that we want to be in. We're not trained just to be in sole specialty. So that's what I really love about being a physician assistant, is that I have a partnership with the doctor, and that's really what a physician assistant is. So
Okay, so for people who may not know what exactly a physician assistant is, could you explain what it is?
So we're just like a doctor. We can see patients. We see the same patients that doctors see. We're trained on the same level. We just get paid a little less than a doctor, but it's actually, the reason I became one is because I went to orthopedic Christmas party, and I was going to be an MD the whole time, but when I went to this party, the nanny was calling, the kids were calling the nanny mom, and I was like, no, I really, work hard to be a mom, and I want to be present in my children's life. And that's how I found out to be a physician assistant, because it would be better for me and my family. So it's been a great career. So.
Okay, and what made you want to get into this healthcare in the first place?
Well, I grew up in a domestic abuse situation with my family, and I always used to see my mom needing Band-Aids or needing some kind of care. And I said one day, and this was when I was about 4 years old, I said, I'm going to definitely be a doctor so that I could take care of my mom. So that's what made me go into medicine, is that I wanted to help people, but mainly because I wanted to be there for my mom and make life better for her.
Okay, so while you're becoming one, a PA, so what made you become a PA instead of a doctor or a nurse?
Like I was saying, I went to that, I was going to be a doctor because I looked at my son when I had my son at age 19, and I said, well, what am I going to do for him? And I always knew that I wanted to be a doctor, so I decided, let me go ahead and start this process now. So I always knew I wanted to be a doctor. I wasn't interested in being a nurse, and they have different pathways too, in order to to see patient. You know, they just have a different pathway, because nurses can go be a nurse practitioner, but to be a physician assistant, you actually have to go along the lines of getting your bachelor's, your associate's, your bachelor's, then your physician assistant. That usually takes about 6 years for you to be able to get all of that, if you're going full time. So I just always knew I wanted to be a doc. You know, but I love being a physician assistant because I have a partner. I feel like doctors always feel like they have to know everything, and as a physician assistant over my years I've learned a lot, but I also don't feel like I have to know everything in order to take care of patients. You know, I think partnerships are super important, so that's why I became a physician assistant.
Okay, what does a typical day look like for you?
Whew, in urgent care. I work in urgent care where people come in for all kind of things. So urinary tract infections, they come in for ear infections, they come in for chest pain, shortness of breath, you know, acute things, and they also come for chronic things because a lot of people just don't have regular physicians that they go and see. So they come to urgent care. It's crazy, you know, it's like people think, oh, I'll go to urgent care and, you know, I'll be out in, you know, a few minutes, or, you know, it'll be much quicker. There's times where people have to wait, you know, at least 2-3 hours just to see us. We usually see about 60 patients a day. I have a partner there, so that partner will see 30 and I'll see the other 30, but it's wild. You know, when you hear your doorbell, your normal doorbells, that's my doorbell that we have in emergency. So I have PTSD every time I hear that doorbell. So, yeah, so it's wild and crazy, and we work 12 hours. But, you know, the goal is to take care of people and help people. So I do enjoy what I do, but like I said, since COVID, it's changed a little bit. People are just a little more demanding. They just want you to just be their prescription pad, as where I'm in a partnership with them and I'm trying to do the best that I can to take care of them.
Okay. So what are the biggest misconceptions people have about PAs?
I think that they think that we can't open our own business, and yes, we can. We just have to have a partner who's a physician, who's at least by telephone, that we can reach, so we can still open our own business. They think that we're not actually, you know, trained as good as a doctor. And I will tell you, nurse practitioners, they go the nursing route to learn, but physician assistants, we go through medical school. So we have the 3 years of medical school, and we go with the doctors, and we learn in a different way that doctors learn versus nurses. They kind of learn from patterns, and we learn by diagnosing things. So that's what I really enjoy about it.
So when people hear you work in medicine, what's something that usually gets wrong about you?
About me?
Yes.
That I'm just not competent enough to take care of patients, because they say, well, they think you're a step under a doctor. But we're under, but we still have all the education and all the training. The only thing we're under is really the money.
Okay.
We're seeing all of them.
Okay.
So the misconception, I think, is just that people don't realize, you know, and then they think we can't prescribe medicine. Like we do everything that a doctor does, it's just less pay.
Okay, what is the craziest thing about your job that most people never expect?
I think the craziest is just, you never know. In urgent care, you just don't know what's going to come through the door. So, I mean, you could see an ear and the doorbell goes off and now you got a chest pain. You know, there's just lots of things that people don't realize that are not appropriate for urgent care. You know, some things you have to go to the ER because urgent care is very limited. You know, we can do labs, we can do x-rays, but we really can't do labs on the spot, you know, or be able to treat you if you're having a heart attack. You know, even abdominal pain is one thing you should not come to urgent care for, because there's nothing we can do but, you know, get some pee and make sure that you don't have a urinary tract infection. So I think it's just crazy that people just expect so much from urgent care, which they expect so much from the providers, which we're really limited, unfortunately.
Okay. Next, healthcare in the Black community. What are some of the biggest issues that you see affecting African American communities?
Well, where do I start? You know, let's start with medical bias. You know, they're thinking that, you know, we can handle pain more because we're Black and brown. You know, that's a bias. You know, you have the personal bias. Oh, because this person doesn't drive a BMW or doesn't have this or get to go on this trip or do this or that they're not, that they're not good people. I think just people need to recognize their own personal bias. There's just a lot of fear in the black community, fear of being guinea pigs, fear of not seeing brown and black providers within the clinics. And it just makes people fearful. So I think right now our biggest problem is really mental health. During the COVID, I've done a lot of research, and I've worked with Colorado Black Health Collaboratives, and we realized that now people are ready to talk about mental health, and there's just no mental health black providers out there, and that's been one of our biggest problems, because a lot of things turn around and always go towards our mental health.
Why do you think so many people avoid going to the doctor until something becomes serious?
I think finances and fear. Fear of, seeing family members who have passed away or who haven't been treated well because of those medical biases. They're just scared. They try all grandma's generational stuff, and then now it's not working, and then they don't know what to do. So I think a lot of it is just really fear, that people are scared to go to the doctor because they don't feel like people understand their journey and what they're going through because they're not black and brown.
And I'm glad you mentioned finances, because one of our viewers said they don't want that ER bill.
Right.
And that's probably why they don't go.
But urgent care is cheaper, it's cheaper. So it's still a bill, no matter what. But people are just scared. I think a lot of it is just fear. They're scared of what someone's going to find out because they haven't had insurance, so they haven't went to the doctor. I think that's the biggest thing, is just fear.
Okay, what are some screenings black men and women should be getting but often don't?
Well, I think for me, one of my biggest things is to know your risk factors. So you should be getting diabetes screening. You should be getting, you should know your numbers. I work with Colorado Black Health Collaborative. You got to know your numbers, what your blood pressure is, what your heart rate is, diabetes. You got to know just what a lot of those numbers are. Those are the most important thing, but also to know your family risk factors. If your family has high blood pressure, it's important to know those risk factors, of eating too much sodium. If you're diabetic, eating too much sugar. Everything is good in moderation. I'm not telling you just to eat. As Miss Angela and me are over here eating some good stuff. Fruits and veggies, but it's just important to know your risk factors. But some of the screenings, getting colon cancer screening, that's every 5 years, to get your pap smears for cervical cancers. Like I said, knowing your numbers, your blood pressure, blood sugars, that's just stuff that you need to know. And those are the screening that's important. But I also have to tell you, prostate cancer is, also on the rise in African American population too, for our men. So to get, the prostate exam, they're always worried about, the actual exam, but it's super important because it lets us know if there's any problems. But you can also tell if you have any problems with your prostate just because your urine changes. It's like listening to your body. So those screenings are important, but listening to your body is super important. We get things for a reason. We get blood in our stool for a reason. That's not normal. And people say, oh, it's just going to go away. It doesn't work like that. You have to listen to your body.
Okay, so how important is it for patients to have healthcare providers who understand their culture and experiences? Because you get a lot of doctors that don't understand our culture and experiences,
right,
and just figure that any medication works for everybody, and it doesn't.
Right. I just think it's important that you pick your doctor. Not just because they're on a piece of paper doesn't mean you have to have that doctor. The most important thing is to have a relationship with your doctor, and people they just take who they get. And I feel like if you feel like this doctor isn't invested in what's going on with you because all they're doing is prescribing meds, then you need to say, hey, I want a second opinion. And if you feel like you need to see a specialist, you need to say, hey, I need to see a specialist. So I think it's just really important that you advocate for yourself. And that's kind of how I feel. The problem is there's not a lot of us out there, and I'm just going to explain to you that we're not getting, people aren't shown when they're young, that this is a possibility, like you can go to med school, they're not teaching us to dream. When I found out I had a learning disability, I basically was told, oh, honey, you should only be a secretary. I went home and I cried, and I got up the next day and I went to school. So we've got to have more mentorships going on, so that we do get more black and brown doctors, to work in the facilities, because we don't feel like they understand our journey, and they don't. So all you have to do is be able to trust your doctor. Find a doctor that you trust and start young. Get a doctor young and have that, as basically for a lifetime provider. That's the goal of a family practice doctor.
Yes.
So interview your doctors. You don't have to take just who they tell you.
Exactly. So, health we don't talk about enough. Why do so many people wait until they're really, really sick before going to the doctor to talk about, like, if they got a pain in their back or they got a pain in their stomach, and then they continue to wait, and then all of a sudden it's a bigger issue than what it really was.
Right. I mean, like I said before, fear. We're for fear, like, maybe this pain will go away. I'm trying all these different things. And then when you realize it doesn't go away, do you have insurance? Some people don't even have insurance. So they're like, where do I go? Now they've got to be ready for this bill, so I'm sorry, did I finish answering your question? Yes. Okay. I could talk a lot, as you guys can see.
What health issues you see all the time that people should be paying more attention to?
To pain control, when they have chronic pain, there's other things that they can do besides just get medicines. I'm a provider. I don't like to prescribe medicines all the time. So being able to know what your pain is dictating, it's not going to get better. We all try to think it's going to get better, but give yourself just a few days. If that pain's not getting better, then it's something you need to be seen for.
So that's what people think is normal. And
yeah.
they when it actually isn't, it's something that they need to go get checked.
Right, right. But like I said, a lot of it is just fear. A lot of people, like I was saying, avoid blood in their stool, like, oh, that's going to get better. And no, that does not get better. You really have to, those are listening to your body. When you're short of breath, why are you short of breath? You have to listen to the signals that your body give you, without trying to ignore that. But like I said, a lot of it is fear. You're just scared of what the doctor's going to say, what your family history has been. So you're scared to go in and be seen.
Okay. Well, it's time for our first commercial break.
Commercial.
This is Reliedon. This episode is brought to you by Reliedon. If you've been dealing with an itchy, dry, or irritated scalp, or you dread to wash your hair day because of tangles, Reliedon was made for you.
I use it.
Created by a professional braider, it's designed to soothe in the scalp and help make detangling easier before shampooing. Healthy hair starts with a healthy scalp, and Reliedon is here to support that journey. Visit House of Braids to learn more, and remember, Reliedon, soothe, restore, and rise.
I use it all the time. It's like hair crack, y'all.
Okay, now back to our presentation. The next one is preventive health. What's one thing people can start doing today to improve their health without spending a lot of money?
Good question. So, walking, just going out walking, super important, just to get that little exercise in. It's really about balance, making sure, you're eating a balanced diet, just getting good sleep, making sure you're working on stress. There's lots of free things on the internet as far as the libraries. You can go and do different activities with them. There's lots of free things at your rec centers. Mm-hmm. There's silver sneakers for our seniors. There's just lots of things that you can do. But it's about really you recognizing what you and your family need. It's like if you guys are eating a bunch of junk food, that's something you're like, okay, we're going to start, trying to eat better and figuring out how to do that, by using different food resources. There's the fresh gardens out now. I just passed by Cherry Creek. They've got great fresh markets going on, and East High School has it also. So I think it's just about asking yourself, what do I need? Do I need more sleep? Get that sleep. That's free. As my daughter knows, and my son, I love a nap. There's nothing like, a 20-30 minute nap. You have to rejuvenate your body. So see what you need. Water. We need to drink more water. If you're drinking a lot of soda, you're setting yourself up for diabetes. So you have to ask what you need in your life and go for it. So, but there's so many resources out there, with the internet, but just in your local communities, being able just to go to the rec centers and just trying to stay healthy, finding out what you need. So finding a therapist, we may not be able to find a black and brown therapist right now, but saying, hey, our family needs help with this or help with that, and going for that, and just trying to take care of you and your family. That's the core of the world. Like, we had COVID, and that's what we needed to learn, is how do we take care of our families. So it's really, there's so many free things out there, just, I believe never grow up, always be a child. So playing, going to the park, riding your bike, all those things are free. If you can't ride the bike, you see all the other bikes. Well, all the other bikes are electric right now, so that's probably not as healthy, but but getting out there and just being a part of your beautiful community, creating walk groups. We all have neighbors that that we can get out there with, and I know our neighbors are not all black and brown, but it's time that we get to know some of our community people, and we do this thing together.
Okay, so I know people talk about different diets and how much does diet really affect our overall health.
Mm-hmm.
And this is a very important question, because people think, oh, if I just eat healthy and I'm going to be healthier, which is not always true.
Exactly.
You can eat healthy, but it's also about portion control and all that. So how much does diet really affect our overall health?
A lot. Basically, the things that we eat are what we are. So, I mean, if you're eating too much sugars, but going back to knowing your risk factors, you've got to know your risk factors. If you've got a huge family of diabetes, trying to avoid a lot of sugars. Not all the sugars, but just knowing that, the things that you're eating, if you're eating too much antioxidants, that can end up leading to cancers. So to know your risk factors, I think, is super important. But your diet plays a huge role. Like if you're balanced, and portion size is important, but are you exercising? I will say that I don't exercise all the time, but we always have room for improvement. But I think that what I was thinking is to know your genetics. If you know your genetics, then you have, a better chance at kind of knowing what you're at risk for. If you're at risk for high blood pressure, a lot of people don't know their history, so if you don't know your history, then you're just out there eating nilly-willy. But that's why I think it's important to go and get, your blood pressure checked in, and you can get that done free at, at King Soopers or something like that, just to be able to monitor and stuff like that. But the things that we eat are what we are. If you're drinking alcohol all the time, not a good thing for you. Alcohol has sugars, then sugars break down. Now you got diabetes. If you're eating potato chips all the time, you're going to end up with high blood pressure. So diet is just super important, because you got to feed the whole body, but it's all about balance. So, just trying to eat as healthy as possible.
And
water.
It's kind of hard for a lot of kids that have been adopted outside of their family.
Right.
Because they don't have that medical history, even though they have their parents fill out what's going on.
That's
half
huge.
of them don't even know what's going on with their family history.
Right.
So it is kind of
So
hard.
I think to maybe just, get your baseline labs, knowing what your cholesterol, high blood pressure, diabetes, what the things are that we can control. We don't have to shoot for, all these crazy other things, because there's just some things we are in control of, and diet is important in controlling that.
Okay. So what healthy habits do you wish more parents would reach out and teach their kids?
Well, I wish that, I love that you said that they're little, because I think a lot of us are babies raising babies when we start having children, and we don't really know what to give our kids. But I think with just the new generation, I think less screen time, getting them outside, getting them healthy, getting them moving, teaching them their family history, about, the health risk factors, and just encouraging movement, I think, is the most important thing. There's just so much going on their Facebooks and all the computer stuff that they have, that it can affect their minds. So I think if you start training and getting a healthy mind early, then those things become easier as they become adults.
Okay, so I have a question.
Mm-hmm.
Can you name some fast food places, if possible, that are borderline healthy?
That would be a no.
Okay.
I mean, everything has salt.
Yes.
So everything, you're going to have high blood pressure. You know, of course, you guys don't want to hear it, but I'm going to say salads, but it's also what you put in your salads, you know. And I mean, you can eat, you know, steak and potatoes at night, but at least have at least one salad a day, I would think, you know, just to kind of, you
Balance
know,
it.
yeah, to balance it out. So it's just all about balance and, like you said, some portion sizes. But I really can't name. I think it's all about the portion size that you're getting. You know, if you know you're going to go somewhere out, you know, at Olive Garden, maybe get, you know, just like a half, you know, a half of it, you eat half and then you take the other half home. You know, so that's how you kind of balance that out. Don't sit there and eat all of that in one sitting.
Well, my other host that's not here right now,
What's Miss Dawn got to say?
yes, always fusses at me because I'll bring in food and I'll eat just this much of it. It might be big food, but I only eat this much because I can't eat that much anyway. So I've learned that portion control is very important. You can have a huge, you can get the biggest salad and have everything healthy on it, but you can still gain weight from that salad because it's not portion control.
Right.
Yes.
Yeah,
Yes.
definitely.
Or
So.
eating to your absolutely full.
Well, you know, here's another thing. We were always taught, eat everything on your plate. Not a good thing. So that's another thing that parents can quit doing to their kids, you know, smaller portions for them so they don't feel like they have to eat it all, you know. And then we have, here comes, you know, grandma, oh, well, baby didn't eat all that. Let me eat the rest. You know, it's like, we have to change our mentally. You got to change for you, and only for you and your family is who you have to change for. So, yeah.
Okay. So what are some warning signs people should never ignore when it comes to eating?
When it comes to eating, I mean, if you feel full, push away. You know,
Because I went to a dietitian and they told me, eat your food in 30 minutes. If you haven't finished your food in 30 minutes, push it away.
that's probably a good thought.
And that's probably me.
No, it's probably a lot of people,
'Cause I
really.
don't eat my food in 30 minutes. I'll take all day to eat
Yeah.
my food.
Yeah, well, like you're saying, the portion sizes. I think that's super important, you know. If you eat, I don't know about the half an hour. Now, you know, people that don't know me, I would do some research on that and I'll get back with you guys. But, you know, dietitians are very important. They can teach you. If you don't have, I mean, like I said, we were babies raising babies, so we weren't taught that stuff growing up. So we have to seek that advice and try to figure that out. So, yeah, I think a dietitian is a great person to start with.
Okay, so
Yeah.
our next topic is building trust in healthcare.
Well, can I back up just a
Yes.
minute? Because you did ask what were some of the signs, the warning signs that people need to know about. So I think this is super important. Stroke. You've got to know the symptoms of stroke. You know, it's out there, it says be fast. So, you know, if you've got your balance is a problem, you got vision problems, you know, your face is drooping, you've got weakness in your arms or legs, you've got to go to the ER immediately. Also blood clots in the legs. You know, people, you know, go on trips, you know, and the risk factors for blood clots is if you're a smoker, you're on birth control, or you've been on a trip, you know, in a car or on a plane for a long time, then you can get redness in your leg and swelling and pain. Even if it's not red, we still get concerned about a blood clot. So that's definitely, if you have those risk factors, you need to definitely head to the ER, and don't come see me because I'm gonna send you to the ER. But, you know, head over there.
Tingling in your feet?
Yeah, numbness, tingling, but tingling in your feet can also mean diabetes.
Yes.
Yeah, but if the leg is swollen,
Yep.
that's what the concern is about blood clots. Also chest pain. You know, women present very different. This is the classic. Pain in the chest, radiates to the neck, goes down the left arm. Women don't just present like that. Sometimes men present, you know, like those typical symptoms, but women don't always present like that. So if you've got pain in your chest and you've got a cardiac history, you know, you've got high blood pressure, you got diabetes, you know, you've been diagnosed with angina, you know, you got all this stuff going on, don't come see me. Go to the ER, because chest pain needs to be worked up. And I've had people, you know, have heart problems and they're young, you know, and they're like, thank you for saving my life because you sent me to the ER. Also, sepsis. Come on, people, if you've got a fever, anything going on, any kind of fever that's continuous, you've got to get into the ER. You know, sepsis can go really fast. Sepsis is basically an infection that you can get in your blood. So that's definitely one that anything changed. Problems with urination. You got a cold for a long time and this fever just keeps going on and it keeps going higher, and the medications you're taking, the Tylenol, ibuprofen, isn't taking it down, head to the ER. Blood and stools, I've already said that a couple times. That's a huge one. You know, blood and stools does not go away. If you got black sticky tarry stools, okay, but bright red blood is okay. But if you got black sticky tarry stools, you need to go to the ER for evaluation, or at least see your doctor, get a colonoscopy. The bright red usually means hemorrhoids, so we're okay with that. But when you start to get consistent changes in your stools, go to the ER. So those are some of the things I think are super important that people should never, ever ignore.
Never had
I'll go
hemorrhoids,
ahead.
But I've heard they are painful, so I'm gonna tell you right now, I'm going to the ER rather.
Okay. Well, okay, if you have hemorrhoids, all we're going to do is tell you to sit in some water and use some Preparation H. It's usually from constipation. You guys are getting a little deep now, but but we're heading over to the ER for black sticky tarry stools. But if you got hemorrhoids, go see your doctor. We can give you some medicine, and that can help with that. But if you've got black sticky tarry stools, you've got to be seen. And I will also say the numbness and tingling that you're talking about. That can sometimes be a slip disc in your back. Numbness, tingling to your fingers, your toes, weakness. Head to the ER because you probably need to get an MRI, which insurance doesn't like to approve. So,
Not at all.
yeah. So
Okay.
that goes back to those biases to who they think needs to get an MRI.
And that comes to our next topic, building trust in the healthcare.
Okay.
A lot of people have bad experiences with healthcare systems. How can patients advocate for themselves? Because I've gone through it too, and my doctor actually told me you got to advocate for yourself. So now that I
Bingo.
advocate for myself, I always did, but not as much. But now that I do, it's like a fist coming back at me because it's like just keep pounding into a wall because they
Right.
don't want to hear me.
Right. Their job is to hear you. You're paying them, so make sure when you pick a provider, it's a provider that you can develop a relationship with. But what I tell people to do is advocate. She said the main thing, advocate for yourself. What is it that you need? What is it that your family needs? What is it that you need? And you go for that. So what I tell people to do is bring a list in. What is you don't have to do the list in the lobby. Do the list when you're at home. What are your questions? Get those questions out. Because you think your question may be stupid, it's really not. It's something that you need to know and you deserve to know.
But you know what's so funny that you said that? Because if you have Medicaid, thank goodness I don't. No disrespect, because I think Medicaid has gone to the point. Medicaid used to be good for people that didn't have insurance, but now they've gotten the doctors where Medicaid would only pay for 15 minutes. So if you have this long list, you have to schedule all these different appointments because it can only be 15-minute visits before they won't pay for it.
What's wrong with that? Schedule you 100 appointments. This is your life. You're in charge of your life.
And some places,
They usually do the top 5.
yeah.
Yeah.
And some places they book 3-4 months out, and these people don't have 3 or 4 months out.
That's why you're coming to see me in urgent care, because you can't get in with your doctor.
Yes.
That's exactly why. But yeah, so my suggestion is bring in those lists. If it takes you 5 months to go through it till you get everything solved. Know your medications. I think it's important. People are like, oh, I'm just taking it because my doctor said. No, know what the medication's for. Have it in your wallet. Also your allergies, have those allergies, in your wallet too, so that if you end up somewhere, or even they have the medical bracelets, you end up somewhere, they know not to give you those medications. So know just what your medications do, how they work. Don't just take, and then know if they're working. If you're taking a high blood pressure medicine, take your blood pressure at home so that you know if that medicine's working. If it's not working, then it's time to have that conversation. Know when you need a specialist. Advocate for yourself. Like, I've had this problem for a long time. It's not getting any better. I would like to see a specialist. Medicaid is different. They have to get everything approved and things like that. But no matter how many times you have to keep going back to the doctors, keep going. But the bias comes in because then they label us as, oh, we have a problem and we're not really trying to do what they tell us to do. But you have to advocate for yourself. So I think that's one of the most important things you can do is advocate for yourself. I have my sister right now who's advocating for my brother in the hospital, and she's made a huge difference in his life. You know, we have to advocate for ourselves, because if no one's talking about you and trying to get you better, you got to do it for yourself.
Yes. I know you've answered this question already. How can someone find a healthcare provider they feel comfortable with? Because you said they need to interview, just don't accept any doctor, because that
Right.
doctor, even that might be the best doctor in the world, may not be that doctor for you.
Right.
So what do you say to people who don't trust doctors or medical professionals, and the questions that they need to be asking these doctors?
Well, I mean, if you don't trust your doctor, you're not going to get any further. You know, you're not, and it's unfortunate, you know, Colorado Black Health Collaborative have made a directory of some black providers here in Colorado. So, you know, being able to get the Colorado Black Health Collaborative directory is important, because that does tell you, but we're not in all the specialties. So you have to, you know, advocate and go to that place and see if you like that provider. If not, get a second opinion. So I think it's just advocating for yourself is the most important thing.
Yeah, because the one black doctor that I do know, that's a neurologist.
Right.
I used to do his hair. Has left and went to Washington, because that's where his next assignment is.
Right.
I'm sad about that, because he's not here.
Right.
You know.
And there's just not a lot of black and brown providers out there. So you know, you're kind of stuck at the mercy of your insurance, and you've got to have trust in them. I don't know how to tell you to have trust except for conversation. That's how. And if you feel like you walk out of there, you know, your heart can direct you to a lot of things. So if you walk out of there like, that didn't feel good, then that's not a person you should go back to. But some people are, you know, good with the books as far as providers, and some people are good personally, you know, and some are good with both. So just realize that they're still just people too, and you just have to go with your heart and your gut and see what feels right to you.
Okay.
Yeah.
Our next section is young adults and health.
Waiting on that one. Please get a primary care, y'all. Please. I know you don't want to go every day and see them, but you have to have them, because they're going to be your doc for a lifetime. This Minute Maid society that's going on right now, where they want to go see the doc just only because I have this ailment. Okay, that's great for that ailment, but genetics, you don't know what's going to come up. You know, you just don't know what's going on. And then you come in and you want to see me in 5 minutes, and it doesn't work like that. So now you're mad at me because now you don't waited 2 hours when you could have saw your doc in 15 minutes. You know what I'm saying? So it's important to, you know, to just do that.
Okay.
So,
what health mistakes do you see young adults making most often?
they're just going only when they have a problem. You know, I think the jury's still out. They're not going to know that effect of this generation until later on, when now they've got all these chronic stuff that they never really went in, and now their doc never was able to work this up or work that up. I mean, there's things like diabetes, thyroid problems. There's lots of things that you can just get basic labs for and just know. But you want to have a relationship with that provider, because then you're able to trust them when they come to you at a later date. But this young generation is just, oh, I'll just see you whenever. They're just not taking good care of themselves, you know. So they don't know what their risk factors are and things like that.
And that goes into our second question: why should someone in their 20s or 30s care about their health now instead of waiting until they're older? And I know a lot of kids don't have that social skill that we had when we was growing up, because you know, we was outside.
Right, well, that's because
playing.
this is their friend. They're just texting and all that.
We didn't have computers. We didn't have cell phones.
Right.
We didn't have nothing. When we got the pager, we was happy.
Thank you. We was spelling stuff on the pager.
Yeah, and we
43770, turn it upside down.
Hello. And we had to remember stuff, so our minds was actually working more
Right.
than what they are, because they have lab tablets and computers and all this stuff that adds up for them, does all this other stuff for them, and we didn't have. So why should someone in their 20s and 30s care more about their health now instead of waiting until they're older?
I think if they don't, that's why I'm saying the jury's still out. I think over time they're going to realize, wow, I should have been going to a doctor for a while. But until we can prove those statistics, you know, it's just going to take some time. But just to have that relationship with a doctor, I think, is the most important thing, and they just don't have time in their busy schedule. And I understand that, but you have to take care of yourself. So I think ultimately you guys are going to end up finding out, oh, this is something I could have found a long time ago, and now we got to deal with this as an urgent problem. So I feel like that's kind of where we're heading with that.
Yeah, and I think one of the other issues that Don had mentioned was about technology. Kids going to
ChatGPT.
Don't mess with my ChatGPT.
Me either.
ChatGPT does not play.
But so people tell me okay, well, I looked on Dr. Google and Dr. Google said this. Okay, Dr. Google's going to always say you got cancer. ChatGPT, I haven't really went to her much yet. Her or him. Yes. I was told they're asexual, so buy my ChatGPT, Breezy. But but I think those are good starts. You can say, well, I have this ailment, that ailment, what do you think? But don't take them as solid gold. Go see your provider. I mean, we were trained, and to me, I could never do virtual care where you just talk to the doc, on the phone. I want to touch you. I want to feel you. I want to, open your mouth. I want to push on you and see what I'm seeing. And ChatGPT and Dr. Google will never, ever be able to do that, even though their goal is to replace the providers. And I think that is possible in the next 10 years if these kids continue to think that this is their doctor.
How does stress impact our physical health? Because I know as older adults, we all have some type of mental health. Mm-hmm. But as older adults, we seem to figure out how to deal with it a lot more because we had that social environment when we was growing up.
Right.
To where kids now don't have social environments, and there's a lot more of suicides and all of that going on.
Right. Well, stress, affects the brain. It can make the heart not pump right. It's pumping too fast. That creates problems with your kidneys. Stress can cause problems with your sleep, so you're not getting the things that you need at night to rejuvenate your body. It can affect your stomach and cause, the whole GI system to slow down, and you start having problems with constipation, and, then you change your whole system, and you get, cancers and things like that because you're not really paying attention. Mental health is huge. If the brain, I think it's just mind, body, and soul. If stress is not, if you're not able to balance that stress, everything else is going to be off. You're going to gain weight, which is going to make you not want to work out anymore. So now you've got higher risk factors of the high blood pressure and the diabetes, and a lot of the depression and anxiety is real. It's, people are realizing it's real now. We thought it was, just situational, but it's real, and it affects our bodies tremendously. So our job stability, you can't go to work because now so now you can't take care of your whole family just because of all the stress you have. So to live in an uncontrolled stress life, I think is going to eventually show that people are dying younger because they're dying of heart disease and diabetes, things just not being controlled. But suicide is real. I struggled as a child with some depression and anxiety and feeling suicidal until I had my grandkids and my kids. I knew it's like, okay, they gave me something to live for. But I think we're just not finding the things to live for in life because we're stuck to the tablets, and we're just only with one person and my little Breezy, but
because we don't want nobody to know what
it's embarrassing. It's embarrassing, so you feel like something's wrong with you, but then as you come out, you're like, all these people are stressed. It's not just me. So how can we, that's what I'm saying, going out, doing the community thing, walking together, building our, relationships together, just having meals together. Grandma had a thing going on. When she said on Sundays we was having breakfast or dinner together, that was important. That was that family tie. We feel so alone right now and so isolated, and it's stressful. And then we see somebody say something about us on Facebook or, talk about our weight, it's just stressful. And I think until we realize, YouTube has great things that you can go to and meditate. That helps with sleep, that helps with stress. I tell my patients, I have a lot of panic attack patients. They come in, I tell them, go to the bathroom. At your job, nobody's going to bother you there, and put on some headphones and turn on YouTube, and do the meditation until you can breathe yourself through that stress. It's just having those things that we learn, and we learn that through mental health too, about these different things that we can do to try to help with our stress. So stress is huge, and it's it's basically, I would call it an epidemic right now. You know, a lot of people are committing suicide, and I would say more than 50% of people actually think about it.
So that includes the next question we have: what does mental health play in the overall wellness? So that kind of runs in with stress as well.
Yeah, I mean, I feel like the brain, you know, it's a symphony. If the brain is together, the body shall follow. So
what's one thing young people are doing right now that's hurting their health without realizing it?
I think they're just so caught up in so much stuff going on, that stress.
I say screen time.
Yeah. Well, yeah, that's all they do is screen time, play games and screen time, but I say it's just causing that stress, you know. We're looking for acceptance from other people, and we need to find acceptance for ourselves. But that comes through wisdom and years of wisdom.
Is energy drinks, fast food, lack of sleep, stress doing the most damage to young adults today?
Definitely those energy drinks. Their hearts is pumping away, and then they wonder why they're anxious. And, you know, the sugary drinks is keeping you up. Like, you know, you're getting the coffee. Let's talk about the coffee in the morning. We got to get the espresso. Now, when our parents was drinking coffee, when our parents was drinking coffee, they had a cup of coffee, okay? That was the cup of coffee a day, maybe 2 cups. Now they're getting these espresso shots. That's doing so much to your body, so much stress on your kidneys and your heart, you know, which then when all that stuff is pumping fast, then your brain is going fast and everything's just, you know, just causing so much stress. So, yeah. You had some other ones in there too, some sugars. What else did you say? Sugars, yes.
I had fast food, energy drink, lack of sleep, because I know that lack of sleep can cause you to have
increased stress,
migraines and headaches and stuff.
Right.
Because you're not getting that sleep.
And increase your stress.
It can increase your attitude.
Yep.
Make you have a very bad attitude.
Exactly.
Lack of sleep.
Thank you.
That's just like lack of hunger.
Yep.
So, what's one health habit every young person should start before they turn 30?
Well, I'm going to go back to get you a doctor. I think it's important to start that partnership. Exercising. I think exercising is important. You know, getting out there, getting moved. You know, and exercise can come not just pumping weights. We can get out there and walk. You know, do some dance classes. You know, there's a lot of line dancing going on right now out there. Get your fan going. So, I mean, it's just knowing what you need. You know, asking yourself, what do I need? And I think journaling helps with that. You know, having someone to talk to. You know, we all think we have to have all these friends. I think we just need one good friend. You know, someone to sit and talk to.
Tell everything.
But that's also the reason why we do these kind of podcasts, is we're trying to help each other, you know, direct each other. So start a podcast. What are you interested in?
Okay, now it's time for commercial break number 2. Y'all know we keep it real here in the kitchen. And speaking of keeping things fresh, let's tell you about Whip It My Way's Lock Refresher Spray. If your locks, braids, or twists or natural hair need a quick pick-me-up between wash days, this is it. Just a few sprays and you're refreshed, hydrated, and ready to go. And it's available in lavender and rosemary vanilla because your crown deserves care every day.
I like that. I like that.
All right.
See, these ladies are making a difference. They're, you know, they're giving us this little love over here. Super important for your scalp.
Okay. Next is Real Talk segment. Okay. What's one health myth that needs to disappear?
You're not in charge of your health. You know, you have to do what people say. Do what the doctor says. Just do what the doctor says. Nope, you're in charge of your health. You know, you don't have to take all those medicines, especially if you don't know what they are and what they're doing, so you're in charge. I think you just need to advocate and know what you need. Once again, I'm sorry I keep saying that, but that is true. If you know what you need, because we all don't need the same thing, you know. We need shelter, you know, we need food, but what is it that you physically need? You know, if you know you need to lose some weight, maybe getting out there, you know, turn on some good music and walking. So I wish it would just go away that you're not in charge. You know, we're just doing what someone says because this is what the doctor says. I want that to go away.
Okay. What's a health myth people need to stop believing?
That everyone's out to get them. You know, stop believing that every doctor doesn't mean good for you, you know, that they are, but that's come from generational things that have happened to us in our families and we watched. So I think that's kind of a myth that I wish would disappear too.
What's the most surprising thing you've learned from working with patients?
Our faith, our black and brown people, our faith. That no matter what we go through, we're always resilient.
All righty. If you could give every listener a piece of health advice, what would it be?
You guys have heard it 100 times. Know your risk factors. Know your vitals, know your risk factors. Know what's going on in your family so that you can make better decisions.
Okay.
You know, with your diet and your lifestyle.
What's a piece of advice people hear all the time that actually isn't true?
That isn't true. I mean, just that we're not in charge of our health.
I know one.
What?
That all thin people were.
You about to bring me to the Barbie Index, girl.
Yeah.
That BMI?
Yeah.
Yeah. So Barbie Index, you know, when they tell you your BMI is so-and-so, I call it the Barbie Index. If your parents ain't Barbie, how do they expect us to be Barbie on that index? It's impossible. So, you know, but then we set our young girls up to where there's, you know, they want to look like, you know, Barbie. And then now they're anorexic. So.
And then they have anorexia.
Anorexia.
And they're bulimic.
Which affects their whole body, their mind, their soul, their spirit.
Yeah. 'Cause I've seen
and that body
someone-
morphology, you know, they're worried about how thin they look, and, you know, they eat and throw up. That's what, you know, anorexia is. Bulimia, you know, they take the diuretics and things, or the laxatives and things just to try to stay skinny, just to be acceptable in our society.
What does being healthy really mean beyond just not being sick?
Balance, mind, body, and soul. To be balanced in all those things. And it takes work. You know, this isn't something you could just do today. This is something that you have to start and you've got to continue. So you have to always reassess what you need. So balance, you know, no, I mean, it's okay to eat the cake, Anime. I like cake, but sometimes you have to say, you know, I'm diabetic and I know and you're monitoring your blood sugars. You're like, okay, those are a little high. So, you know, maybe not today, or maybe have a smaller piece. You know, it's just balance in the things that you do in life. And that's how you balance your mind, body, and soul.
All right. What's something you've heard from patients that made you realize that they need health education?
Everybody needs health education. You know, people, there's all these different beliefs, you know, that people have. I'm sorry, I'm trying to come up with examples, but there's just beliefs that people have, and it's just based upon what they grew up with, what their grandparents did, you know, and I think it's just, you have to seek out the knowledge to be better. The knowledge is out there.
All right. What's something social media gets completely wrong about health?
They're directing you. When they make that really big burger at that little restaurant, they're saying, okay, now we're going to give you high blood pressure. I'm so glad you brought this up. You know, they say now we're going to give them high blood pressure. So now who gets the kickbacks? It's the doctors. You know, when they make this really big sugary thing, and, you know, now Starbucks has this new sugary drink, you know, now they're giving you diabetes. So I think it's just the packaging out there, you know, the way that they're putting out there, the marketing. Who has the most money to put the good marketing out there that pulls us in, like, oh, that looks really good. And, you know, you remember the sandwich, the chicken sandwiches at Chick-fil-A and Church's Chicken. I mean, they had all these different sandwiches, but they're all still, they're drawing us in with advertisement, and then this creates the health problems. But they're getting a kickback on the side. That's where they're kicking our health up so that we're going to the doctors more.
Okay. So, next, we have another commercial break.
I love these commercial breaks, y'all.
Listen, healthy hair starts at the scalp. That's why I love Whipping My Way Lock and Braids Oil. It's designed to moisturize your scalp and support healthy hair growth, makes your edges grow too, and strengthen your strands. I especially recommend using it after a fresh cleanse to lock in the moisture. Whenever you wear locks, braids, or just your natural hair, this oil belongs to your routine. This is something you don't have to use every day. You can use it once you cleanse your hair. It's best to use once you cleanse your hair because it gets into your pores and it starts to moisturize your scalp so you're not walking around here with a dry scalp.
Which is really an important thing because Colorado's so dry. We don't drink enough water.
No.
So we got your solutions right here.
Yes.
Like I said, Don be hooking me up, y'all.
Okay. Next one is Black Community and Family Health. Okay. Why do you think health conversations are still hard to have in a lot of Black families? And I know it's hard. As an example, when I became diabetic, I didn't know anybody in my family was diabetic, not a single person. Then all of a sudden, I tell everybody, oh, such and such is diabetic, such and such. And I'm like, so I've been lying on my questionnaire at the doctor all this time?
Exactly.
So, why is that a hard conversation?
How we were raised. Our parents don't talk about their health problems. Auntie don't talk about her health problems. Nobody talks about it. And that's why I'm saying for this new generation to know your risk factors, to know what's going on. Because you never know, your cousin could have the same thing as you. And now you guys can go on this journey together to healing.
So how can families start to have better conversations without thinking somebody's going to judge them? Because I know a lot of Black communities, they feel somebody's going to judge them because they had this. Oh, if you would have ate this, you wouldn't have been this. And that's how we judge people.
I think it's a generational thing. The elderly, they don't like to talk about their health. I think it's going to take us now, and like these podcasts, to bring up these conversations, and to start talking about those things.
Okay. Now, personal and powerful questions. What is one patient story that changed the way you look at life without the HIPAA violation thing?
Right. So I had a patient come in and see me in trauma for, I can't remember what the specific problem was, but the doctor tells me before he comes in, a white doctor, says, hey, he just got out of jail. He's just really weird. I'm like, well, okay, I'm not going in with that bias. I heard what he had to say. Thank you. He's still human. So I went in and I talked to him, and some of his questions were a little out of line. He wasn't answering things, and his girlfriend was like, he's just a total different person. That's what the key was for me, is that he's different and she knows him. So I did an exam, and neurologically he had some stuff going on. So I referred him to the neurologist, and turned out he had ALS.
Ooh.
Which is a very devastating muscular disease that you eventually die from. So I learned so much from him and it was beautiful. His kid, his girlfriend was pregnant at that time. They came back, and I was able to see him go through that journey, but within 3 months he was gone. So another bias, almost got me in tears, but another bias, just listen. I could have listened to that doctor, and I could have went with that, oh, he's just a problem patient. But this man was able to see his son, born, and he lived in a wheelchair for those 3 months, but he was very thankful. He came back and told me thank you.
Prayers go out to that family.
Yes.
If it ever gets back to them,
And I've seen her several times, yes.
What's the biggest lesson you've learned from taking care of people?
That
was one of them.
Go with your gut. Go with your heart. Like I tell I train people And I tell them, go with your gut. You don't want to go home and be like, I wish I could have, I wish I would have. Do what you feel at that moment. If that person needs that lab, order that lab. If you feel like that person needs to be sent, I'll refer you in a minute. So if you see me, I'll send you right on to the clinic and do an urgent care, urgent referral to where you'll be seen in the next 5 to 7 days, as where so many people are waiting, for 3 months or so. But go with your gut. Like, God gave us that gut and that heart for a reason. If you feel something isn't right, follow up with the patient, because I'm there. I feel like I'm there to treat everybody, like my mother, my sister, my brother, my father. I'm there to treat the U.S. family. So if you come see me, I'm going to treat you as family, and I'm going to refer you quicker if that's what you need, or we're going to get you taken care of sooner, because I got to go with my gut. I pray every morning before I go to work on that way, Lord, please don't let me see 1,000 people today, but please give me the knowledge and the strength and the power to be able to take care of his people.
I be having to ask him to keep me close to the cross. Because I be knowing. If you had an entire country listening to you right now, what is one of the health messages you would want everyone to hear?
Know thyself. See what you need, and seek that information. It's out there, but you can't do it alone. You have to have a primary care doctor. It's just, you've got to have somebody as a partner. And those partners come with sometimes a PA, and we're still just as good as the doctors. We train and we learn with them. So know what you need, but you only know that if you start to learn yourself.
And when it's all said and done, what does being healthy really mean?
Balance. Balance your mind, your heart, your diet. Just balance in your life. That's being healthy. And always trying to be happy as much as you can. We learn more through our sad times than we do through our good times. So celebrate those good times. And when you get that lesson that God is trying to get you to get, try to get the lesson so you can get on to the next one.
All righty.
So,
as always, thank you for pulling up a chair, Lisa.
thank you for inviting me.
joining us.
Don, I'm missing you, girl. Wish you were here, girl.
And joining us at the table today. We hope today's conversation gave you something to think about, something to talk about, and maybe even something to inspire you to take action. Knowledge is powerful, but applying it is what changes lives. Be sure to follow us on Facebook, subscribe to our YouTube channel, and turn on your notifications so you never miss an episode. We'd also love to hear from you, so leave us a comment and let us know what topics you would like to discuss next. Until next time, keep learning, keep growing, and keep having the conversations that matter. This has been No Cameras in the Kitchen, where the conversations are real, our lessons are honest, and everybody leaves the table with something they can use. God bless, and we'll see you next time. Until then, the kitchen is closed and the conversation continues.
How'd that go? We didn't get to any questions.